We get a physical exam every year to stay healthy, a dental exam to make sure we don't have cavities, and we exercise regularly to stay fit.
But what about mental health? Our brain is an organ and muscle also.
All too often, we don't take the same preventative measures to make sure our brain is functioning properly. In December, the Surgeon General Dr. Vivek Murthy issued a public advisory stating that the mental health situation among youth is an urgent public health crisis because of the extended pandemic.
Kids are experiencing some really significant concerns, and it's starting to overwhelm the systems that we have.
We are seeing a huge increase in not only kids presenting with mental health issues, but the acuity level, the severity of kids with the issues that are presenting.
Although the need for mental health services is increasing for youth, there are still many barriers to treatment.
Often mental illness is treated differently than other medical conditions when it shouldn't be. Comprehensive health care should include both physical and mental health.
Mental health challenges among youth are a serious concern. It is the leading cause of disability and poor outcomes, affecting 1 in 5 children.
More and more teens and young adults are becoming overwhelmed, stressed, feeling pressure to perform, and it's definitely having an impact on them developmentally and emotionally.
More than 7.7 million children are in need of mental health services in the U.S., but only half are receiving treatment. The main reasons for inadequate treatment is access and coverage for mental health disorders are more restrictive than other diseases. When mental illness is left untreated, it can have dire consequences resulting in other chronic diseases, homelessness, substance abuse, incarceration, disability, and lost productivity.
The untreated part is the most serious part of the mental illness. It's kind of like if you shake up a bottle of soda, what's going to happen is eventually it's going to explode.
In severe cases, mental health disorders can lead to needless violence and tragic deaths. 70% of youth in the juvenile justice system have a diagnosable mental health condition.
Over the years, the government has tried to address discriminatory practices in health insurance coverage through state and federal laws.
In 2008, Congress passed the Mental Health Parity and Addiction Act, which required insurers to have equal coverage for mental health and substance use disorders like other medical services. The Affordable Care Act, passed under President Barack Obama in 2010, further expanded mental health coverage.
The Affordable Care Act helped millions of Americans create access to affordable quality health care. It ended the discrimination, eliminated pre-existing conditions, eliminated lifetime caps. It allowed for young adults to stay on their parents' insurance until the age of 26. And it expanded Medicaid, which is one of the ways in which we brought so many people into healthcare coverage.
Even with government intervention, disparities in mental health coverage remain. The type of insurance that a patient has, either public or private, dictates their quality of care.
Dr. Untreated states, mental health care is a chronically underfunded sector of the healthcare system. Many mental health providers do not accept Medicaid coverage, and that is often driven by the lower payment rates. The problem is, many families are paying for the bulk of their therapy fees. Also, non-reimbursable fees are often cost-prohibitive to families from low-income communities.
Not everybody has coverage for mental health care, and not everyone can actually afford their copay.
The number of adolescents that even meet a provider, have a therapeutic plan developed, have ongoing therapy sessions, is probably less than 1%. If you looked at even most private health insurance plans, for mental health visits in a given year are significantly limited.
New government leadership can also cause shifts in healthcare policies and impact the ability of youth to get treatment.
130 million Americans have pre-existing conditions, and they are affected.
We would find ourselves losing insurance for millions of people, losing the benefit of no pre-existing condition limitation.
When Obama was no longer president, the standard was if you can afford care, you can get care, and if you can't, then it's up to you. The funding dried up and the programs disappeared. And all of a sudden, you found hundreds of thousands of people with severe mental health needs on the street, increasing the homeless population.
Millions of youth are struggling with mental health and not getting treated. when medical care should be available to prevent it from getting worse, similar to any physical illness.
We need to be doing a better job, I think, of finding a way to develop some different options along a continuum of care where we can assess pretty quickly what the needs are for kids mental health wise, and then connect them with services that meet that level of care.
Mental health issues and mental health coverage are really inadequate in this country. The amount of attention that we pay to them, the resources that we give. We have to really increase the access, make it more affordable, make sure that it's got parity with physical health needs.
The Surgeon General's report is a timely reminder to our nation's leaders that we need to reprioritize mental health care for children, teens, and young adults.
We need to invest in the ways that we're doing prevention, education, changing the stigma around mental health, and really revamping our entire conceptualization of how we ensure that Americans can be safe and resilient against future stressors.